Welcome to Agrace. My name is Lynn Myers, and I'm fortunate enough to be the president and CEO of this organization. I want to thank you for becoming part of our team. We help people in our community through one of the most important journeys of their lives, the journey through a serious illness. Agrace's mission is to partner with patients and families to improve quality of life throughout serious illness. That means giving people with serious or life-limiting illnesses the care and support they need so they can focus on the things that are most important to them and to their family. That might be relief from pain or other physical symptoms, or just being able to stay home and not having to go to the hospital. It might mean being well enough to take part in a loved one's wedding or even a graduation ceremony. The Agrace team is made up of experts in pain and symptom management, but we focus on much more than the progression of a disease. We help each of our patients live with comfort, dignity, and the greatest possible independence through the stages of their illness. We listen to them talk about their hopes, their fears, and importantly, their goals. And we do what we can to help them accomplish those goals. Our care necessarily includes the patient's family, whomever they consider to be family, because serious illness is rarely a journey one takes alone. Agrace's vision is to lead the evolution of hospice and palliative care through innovation, education, and access. One patient, one family, one community at a time. For too long, hospice and palliative care have been unfamiliar concepts for people. But things are changing. More and more, healthcare providers, families, and patients are talking about these important concepts. If we are successful at educating the community about the benefits of palliative care and hospice, we will surely reach a time when people understand these options and expect to have this compassionate, goal-centered care available.
We are caring, respectful, accepting, forgiving, patient, and empathetic. We listen to our patients and families and work hard to make sure we understand how they're feeling and what they need from their Agrace team.
We are honest, reliable, trustworthy, and courageous. Agrace's integrity extends from the delivery of excellent care through our commitment to the state and national standards for hospice and palliative care.
We're generous, involved, open-minded, adaptable, humble team players.
Our nurse assistants, social workers, chaplain, grief counselor, volunteer nurses work closely with palliative care physicians to ensure that the patient and family goals are being met.
We also collaborate with community partners such as long-term care staff, hospital and clinic staff, home health agency, and community physicians to provide the patients the services they need.
Agrace strives to be a leader in hospice and palliative care, and a focus on quality drives everything that we do. From professional development and ongoing clinical education to patient care and family support.
Agrace is fortunate to have the resources of time, talent, treasures, environment, community, and goodwill. We respect these resources and work hard to preserve and grow them through ingenuity and innovation.
Agrace provides both hospice care and palliative care. First, let's talk about palliative care. It's really an umbrella term used to describe specialized physical and emotional care that focuses on the patient's comfort and quality of life. If that sounds familiar, it's because hospice is one type of palliative care. Some forms of palliative care can be provided at any point in a patient's illness, and we'll talk about that in a minute. Now let's talk about hospice. Hospice is comfort care for patients who are in the last 6 months of life and are no longer seeking a cure for their illness or condition. When a patient or family chooses hospice care, they make the decision to focus on their personal goals so the time they have left is meaningful. To create a plan of care, the Agrace interdisciplinary team asks questions about the needs and goals of both the patient and their family. A hospice plan of care considers the whole person, body, mind, and spirit, so it addresses emotional and spiritual needs, as well as pain and symptom management.
Any pain today, or?
This patient-centered approach allows each patient to have a voice in how they want to live out their life.
All you have to do is let me know.
Hospice services also include support offered to the patient's family and friends. Agrace's Grief Services team provides support for 13 months following a patient's death. Our support can include pre-death visits by the counselor, phone conversations, and face-to-face discussions. It can also include participating in one of our specialized grief groups. These groups are geared to specific types of losses, such as the death of a spouse, a sibling, or a parent. In fact, we have grief groups for children as young as 5 years old. Agrace has been the community's nonprofit hospice since the early days of the hospice movement in America. But today, we're so much more than just a hospice. By expanding to offer other palliative care services, Agrace can now work with patients and families much earlier than just at the end of life. Agrace's palliative care consultations help identify the medical, emotional, and social issues that affect the patient's comfort and overall quality of life. With our expert recommendations, patients and their healthcare providers can consider changes that will help improve comfort and relieve distress. For some patients, a palliative care consultation may lead to enrolling in Agrace's Care Navigation program. This subscription service is for people who struggle with a chronic or serious illness but are not eligible for hospice or home care. Care Navigation includes guidance and education from a registered nurse, along with medication management and coordination of medical appointments. This assistance helps patients manage their illness more confidently at home. The monthly cost of the service is often offset by the savings that can occur by reducing the need for emergency room visits or repeat hospitalizations. At Agrace, trained volunteers are integrated into everything that we do. From greeting visitors as they walk into our buildings to sitting vigil with dying patients. These individuals enable us to do the special things that Agrace is so well known for. We're so lucky to have them.
I love serving Agrace's mission by volunteering in the Dock Rock Cafe and also the kitchen. I have learned to do many things that I enjoy, and I serve the patients, the families, and staff.
Some Agrace volunteers work directly with patients and families at the inpatient unit, the inpatients' homes, or in long-term care facilities. Other volunteers like me support the agency in other ways, like doing office work, gardening, or helping at the thrift stores.
The original orientation, it was very informative, great people. They actually had volunteers come in and talk about their experiences at Agrace. And so you felt, so when it was your first day coming in, after the orientation, you were able to go in and feel like you can do this.
I volunteer because I have fun. I feel there's a real camaraderie between the staff and the volunteers. I also really enjoy sitting down with somebody for 20 minutes or a half an hour and just chatting with them about what their week has been like, or even further back, what their life has been like.
Ina her pain was becoming more severe, so we contacted hospice. Our daughter Judy is a nurse, and we talked with her and the rest of the family and decided that it would be better if Mom was here, where she'd get care 24 hours a day.
I knew this is the best place for me to be. I couldn't do this on my own.
But it's so good to see.
Since 1978, Agrace has been helping patients and families in Wisconsin through life's most meaningful journey.
I really don't have a fear of dying. It's the struggle to keep living that's the problem, and hospice makes that much easier.
It is our mission to improve quality of life through the stages of serious illness. Agrace makes comprehensive hospice and palliative care services available to every eligible person in our community.
I'd recommend it for people that have home health care issues like we were faced with.
The sole purpose of the Agrace Foundation is to support Agrace's mission. We raise money so that no one who needs hospice or palliative care services is ever turned away because of an inability to pay. Although Medicare, Medicaid, and most commercial insurers cover the cost of basic hospice services and palliative care consults, Agrace provides more than basic care. Several essential programs and services we offer are either underfunded or not funded at all. Donations help us do so many of the things patients and families need.
I think that the reason it's important to give is because it's a shared experience. It's something that we all ultimately will be touched by end-of-life experiences by somebody that we know and somebody that we care for.
Well, I think one of the nice things about donating is that the money is used locally. We're not sending a check off to a multinational conglomerate somewhere else and then it's trickling back to our community. We have a good idea when we give the money here. We can see where it's going.
Here are some of the many ways our community can show its support for Agrace's mission. Your gifts make our community a better place to live by making exceptional care available to all local residents, and by ensuring that surviving caregivers, family members, and friends have help as they cope with the loss of a special person, even if that person that they lost was not a patient at Agrace.
Without hospice, I couldn't do this. I couldn't stay in my own home. And I think that's the most important thing, that with hospice, you can stay in your own home. Thank you. Thank you so much.
We couldn't ask for anything better.
I'd recommend it very highly. I can walk around the hall and everybody calls me by my first name. And I can go down to the coffee shop and then, hi Maynard, how are you today? You know, I go here and how are you today? How's Ina today? You know, so it makes us feel like we're almost at home.
The Agrace Foundation is deeply grateful to those who have offered support and contributions. They have helped Agrace serve our community for more than 35 years and will allow us to serve for many years to come.